Hello, everyone. Thank you for joining us for our latest installment in the Bay Area Impact COVID-19 webinar series, Getting California Back to Work. My name is Henry Bartholome. I'm a policy manager here at the Bay Area Council, and I work on both our Workforce of the Future and Gender Diversity and Inclusion committees. We're focused on ways to strengthen talent pipelines for our employer members while building more well-paid opportunities for diverse workers here in the Bay Area. Before we get started, I wanted to go through just a couple of housekeeping items. So throughout the webinar, we encourage you to participate and ask questions through the Q&A box at the bottom of your screen. You should see a Q&A function. You can include questions in there, and we will hope to answer most, if not all, of those questions during the latter half of the webinar through kind of an audience Q&A session. And then the other thing I wanted to note is that this will be recorded, and the link to view the webinar after we complete the webinar will be shared with all attendees following the webinar. So with that, I would like to begin the panel. So today we will be digging into what returning to work looks like here in the Bay Area, and it's going to look a little different depending on the industry. As we slowly ease back to normalcy, what do we need to do to make sure we are safe, measured, and responsible? I'm excited to introduce our panelists today. We have Joydeep Ganguly, Senior Vice President of Corporate Operations at Gilead, Sam Glick, Partner at Oliver Wyman Health and Life Sciences and the Director of the Oliver Wyman Innovation Center, and Karen Strack, the Senior Vice President of National Operations, Sustainability, and Retail Delivery at Unibail Rodako Westfield, otherwise known as URW, and co-chair of the reopening of retail in Los Angeles. Thank you all for joining us today. So to get things started, I would like to open with Sam. At Oliver Wyman, you quickly jumped into action in response to COVID-19 and developed the COVID-19 Pandemic Navigator. Could you tell us a little bit more about how the Pandemic Navigator works and how Oliver Wyman is using it in this next phase of reopening?
Happy to, and thanks, Henry. It's good to be here with everybody today. As it became clear that COVID was a crisis that was going to have a material impact on people here in the US and around the world, and it was going to be one that was here to stay for a while, we took a look at the kind of both predictive models and tools that were out there to help businesses, and really realized three things. One, we realized that while there were a lot of predictive models out there about when hospitalizations might be coming, when the surge was coming, how we thought about flattening the curve, all of those things that we've heard in the news for months now, and seem to have become part of the vernacular, that many of those models were static. They started with an assumption of a transmission rate, if you will, an R naught, or a beta as a more sophisticated version of that, and really then just played that forward. And what we knew was that there was a lot we didn't know about COVID in society, and that our understanding of how COVID was transmitted, how people were going to be behaving, how social restrictions might be coming down, et cetera, meant that the transmission rate of COVID and the rate at which people get infected would change over time. And so we have a team of data scientists who work with some of our infectious disease specialists and our healthcare experts to get together and say, how can we create a more dynamic model that actually continuously adjusts to the real effect we're seeing in the world? So not just did a policy come down, but mapping it to Google and Apple mobility data and seeing if people are really changing how they move, and we can see in the data if that's changing the transmission rate, that kind of thing. So we tried to build a more accurate predictive model that really reflected the fact that we didn't know a lot about which tools would work and which ones wouldn't with COVID, and we needed to be able to observe in the data how the situation was changing on an ongoing basis. The second thing we realized was that there are a lot of businesses out there that needed a lot more than just to predict the next wave of cases. I spend most of my time with healthcare organizations, and that's actually a really important question for healthcare organizations. When is a hospital going to be hit hard? When does a health insurer need to be able to respond? But if you run businesses outside of healthcare, it's really the long view that matters more. It's what's the second, third, fourth wave going to be? How do I think about when employees can come back to work? If I'm in the lending business, how do I think about which industries might be hit hard and who I should be lending to and not to? If I'm in the construction business, well, which counties are going to be hit hardest and when can I get back to work and have new projects? It's these much more kind of second order, third order questions that businesses were worried about. And so we built the Pandemic Navigator in an extensible way to say we can start from this kind of common base of predictions about what's happening with the pandemic, but then build on top of it all of those various business applications, really with the mindset that businesses were not just going to be in crisis management mode, where traditional crisis management mode is, the crisis comes, it surprises you, you deal with it, and then you go down a recovery, and that instead it was going to be these waves of crises in a much longer haul than we might have seen in the past. And then the third thing that was important to us, just given our mission as an organization, is that there are a lot of organizations out there that couldn't necessarily afford to have their own data science team or to hire consultants like us. And so we made a commitment from the first day to put our base predictions online and make them available to anybody who wanted to use them. And so we have thousands now of public health departments, governments, health systems, others who can draw from the data on a regular basis and do that. And I'd encourage anybody here, you're welcome to take a look at what we've got. It's just pandemicnavigator.oliverwyman.com, but it gets a little better every day, and it's part of doing our part.
Awesome. Thank you so much, Sam. I think it's really great to see it being a resource for everybody in these circumstances, especially. So I want to kind of go around the horn and get a perspective from each one of you. So we'll move on to Karen. Retail has been massively impacted by COVID-19. How is URW working to ensure both your employees and customers are safe as we return to shopping? And what are you doing differently to adapt to the changes brought about by COVID-19?
That's a great question. So we've had to retrain our employees to new customer service standards and roll out new programs that were much more directed towards self-service. And all of our team members have been trained on the proper use of PPE per local guidelines. So I think that from a customer service perspective, one of the things that we're constantly challenged with is in customer service, that the ability to smile and engage and connect to the shopper, the customer in general. And it's one of the things that, we're really working towards what that new level of engagement looks like. For our customers, the health and safety of our shoppers is really our number one priority. We've implemented digital line queues, which is really new for us, so that if you visit our Westfield app at the local mall that you shop at, you can actually go to a digital line queue versus physically standing in the queue on site in the mall. So we've really tried to embrace some new levels of technology to make it a better experience on behalf of the shopper. We've also removed a lot of the common area seating. We've implemented things like hand sanitizer stations everywhere. And our cleaning protocols for high frequency of proper sanitation has really obviously increased tenfold with new programs that we've implemented around the colors of the rags that they're using, so that we can understand what's been touched and what we still need to continue to clean, and the frequency of what that looks like. So that kind of just tells you a little bit about what we're doing on our end. As for the second question, I think you asked about our ability to adapt to changes, kind of, and what's happening. And I think that in general, we're reinventing, coming together in a totally new way. Our partnership with our tenants has been a very accelerated sit-down discussion with them at the highest possible level, so that we're communicating and aligned in the experience that we want to give the shopper, and then trying to work with them on things like curbside delivery, permanent stations and parking lots for pickup pieces, embracing any sorts of technology that they're doing that we can put onto our platform. And then our high touch experiences, things like micro gyms, theaters, offices, doctor office buildings, that we really want to make sure that, again, we're communicating the well-being of the shoppers. And so getting in front of those, working with the CDC guidelines, has been a critical aspect of how we've continued to move forward. So we're excited to see the majority of our centers open and operating, and we've had the great privilege of being owned by a Paris organization, and they've been a few weeks ahead of us. So we've been able to really leverage learnings from many other countries as we've reopened a lot of our centers.
Thank you. That's lots of changes, but a lot of it sounds very exciting and different. So we'll move on to Joydeep and just get a little bit of perspective from a different sector. We know that Gilead has been in the news around therapeutics, but first I kind of want to get a sense of, what is Gilead doing to ensure your employees are safe, especially given that it's this manufacturing side of things. We'd love to get your perspective on that, and then we'll kind of open up to more of a discussion amongst all of you.
Well, thanks, Andrea. Again, I appreciate the invite here. So, I mean, much like the two speakers before we said, right, we are adopting some fundamental hygiene and safety rules, right? We're intensifying cleaning, we're intensifying the less densification of places, we're putting engineering controls in place. There's a huge component of having good HVAC systems and good airflow across buildings. And we're also doing a lot of stuff in terms of ensuring that the social distancing that we do have adheres to the limits right now. What we are doing slightly differently is, unfortunately, we don't have the privilege of just having everyone work from home. And I think I mentioned this to you in previous meetings, right? I mean, we haven't found a way to develop, discover, and manufacture drugs with Zoom yet. And I'm sure robotics will come at some point in time, but we have to have people on campus. We have to have people connected. And we've just spent a rather, we've executed on a very ambitious master plan that changed the face of the campus to mirror our innovation engine, where if you look at our campus, we have research buildings that go to development buildings, that go to formulation buildings, that go to commercialization buildings. And that innovation engine and the campus, our secret sauce lies in the fact that people can discover and develop drugs based on collision of ideas that occur naturally. So for us, having people on campus and having people co-located is a source of advantage. And it's one that we don't necessarily want to diminish. So my task as the head of operations is to find a way to get as many people on campus back safely. And we've got a threefold strategy, which is one is a day one strategy, which is use manual and safety controls, PPE, cleaning, social distancing to get people back, a critical mass of people back on campus on day one. Day two is to actually leverage the fact that we're in the Bay Area. We have access to some of the best and brightest technologists in the world, right? And we get a bunch of material science folks, we get a bunch of folks that actually figure out a way to increase the capacity we can have on campus safely by using very, very good analytics, very, very good technology, and some digital solutions. And I think day three for us right now is we figure out how we rationalize our entire footprint based on this new normal. But at all points in time, I think one thing that is underscored in this is besides the physical stuff, besides the work stuff, one of the things we've been overemphasizing also is the emotional well-being of our employees. This has been a seriously disruptive sort of element right now. And we want our workforce motivated, we want our workforce engaged, and we want to appreciate the individual priorities people have. So our response to this from an employee safety perspective has been both physical in terms of our campus modifications, but it's been balanced by a equal emphasis on emotional well-being for our workforce that hopefully will drive not just productivity, but a greater sense of satisfaction.
That makes tons of sense. Thank you, Joydeep. I think the emotional well-being is one that is, impacting everybody in the world right now, and especially important to continue to support our employees. So I want to remind the audience that to ask questions, you can use the Q&A function at the bottom of your screen, and feel free to submit them now, and we'll get to them when we open up to the Q&A section during the second half of the webinar. So for the next question, I know we've talked a lot about different things you all are doing to ensure that employees feel safe, that they feel like the environment is sanitized. I think a natural next step is, what do health and safety standards look like in the future? Obviously, a lot of what has been done over the past 3 or 4 months has been reactive to changes and new guidelines coming from the CDC. But from your perspectives, do you see longer term changes that change how we look at health and safety? And we can start with you, Karen.
I do see long-term changes overall in many industries when it comes to the health and safety of whether it's the experience that you're having at a stadium, a concert, test driving a vehicle. I think that things like, the valet experience will start to look a little bit different in regards to what also the expectations are of the end user. And I think that today we're still really trying to understand and collect that information so that we can provide those experiences long term. But I think overall, the really nice thing from a shopper perspective is that you're seeing, at least, from what we've viewed, is we have shorter hours and the shoppers coming in are purposeful in regards to what they want. And it's nice to be able to see that retailers have the ability to collect the same amount of revenue in shortened time frames. It's really helping them from an expense perspective, and it's still providing a good experience to the end user. So I think that those are some of the things that I hope to see continue as we continue through additional phases of reopening.
Sam, what's your perspective kind of with the analysis and the data that you all are looking at? Do you have kind of a vision 6 or 9 months from now what this might look like?
Yeah, so I agree with Karen. I do think there are going to be some permanent changes here, and it's I think a lot of us are holding our breath, waiting for a vaccine or a scale therapeutic to come through. But the reality is that even when we have availability of something like that, the amount of time it will take to ensure that most of the population has access to it and is willing to receive it is significant. And there's only one disease in history that we've fully eradicated, and that's smallpox, and that took 200 years to do. We all see the annual flu shot campaigns, and even despite those best of efforts, only about 50 or 60% of people end up getting their flu shots as a result. And so we will certainly move into a place where we can be less vigilant, but I think these safety standards are here to stay, and that's certainly what our clients are telling us. Things like thinking about density of spaces, thinking about how public restrooms are set up, certainly large group gatherings, and what kind of support and treatment is provided about that. And frankly, just more of a conversation, I think, with employers in particular about people's health status. The number of barriers that have had to come down very quickly as a result of COVID is quite interesting. I mean, we now have employers checking temperatures. We have people self-identifying as part of vulnerable populations. And what had previously been a wall has become much more of a conversation. So I think we will continue to see that. The other question that we keep looking at is how permanently will consumer behaviors change? And on the scale of kind of global events, if you think about something like the Great Depression lasted several years, but it changed the habits of a generation. And if you, like I do, have anybody in your family who lived through that, long after they had much greater prosperity, people who lived through the Great Depression behaved differently, and still do. On the other hand, you look at an event like 9/11, and in fact, air travel went way down, and then with good marketing and a booming economy, rebounded within just a few years. We don't know where COVID's gonna sit kind of on that spectrum. And we've seen recent events that have changed habits. I mean, we know that people who graduated in 2008 and got their first jobs still to this day are more conservative investors, and have missed out on some of the last 10 plus years of economic prosperity. We've certainly seen some of the changes in housing dynamics right here in the Bay Area. San Francisco rents down 9% over the same month last year. Mountain View rents down 14% over the same month last year. Is that permanent? We don't know. But for businesses, it's not just thinking about kind of what safety measures are we putting in place in the same facilities. It's, are people going to want to live in new places? Are they going to think about new ways of working? Are they going to put new value on certain types of benefits or job security? And it's too early to tell, but we need to be thinking about it.
Joydeep, from Gilead's perspective, I mean, do you see long-term changes? I mean, both obviously the health and safety standards are a key part of it, but to the way that you operate, from a manufacturing perspective, does this change the way that you look at that in the next, many years?
So, I mean, I'll be honest with you, I don't know, right? I mean, as a science-based company, we always err on the science that if you believe that we have to change behaviors, it's a vote against the science, right? So we hope a vaccine comes out, we hope a therapy comes out. I agree with Sam. Yeah, smallpox is the only one eradicated, but we have cured Hep C, we have cured multiple diseases. It's a bunch of things we have moved forward with. And the question right now is, even if there's a vaccine, so I agree with the speakers that, yeah, it'll change behaviors for good. What I don't know is if a behavioral change is necessarily the best way to approach it, as opposed to finding a different way of working, right? Because we've got an opportunity here right now to take a crisis that has prompted us to rethink everything from where employees are located and how they come into work. And, is there ways to accelerate digital revolutions that were nice to haves in the past, but now are imperatives, right? How many of us did Zoom 3 years ago, right? On video calls, we'd normally get a conference call in and dial in. But I don't know. I mean, I don't see this. I don't subscribe to the theory this is going to be a long-term perpetual stuff, because that would just say that, what, then, vaccines and therapies and science is going to fail us, right? And I can't, just being where I am right now in the company I am, sort of say, yeah, we'll just raise our white flag and right now say, what, safety standards have changed, everything's changed, we'll never handshake and move forward, because it doesn't give me purpose in what I do on a daily basis. But things will modify, right? And I love Sam's sort of counter between the 9/11 case and the depression case, right? And I think there's some lessons here to be learned about how we recover that can sort of morph into that. But I apologize for rambling here, but I don't have a good answer on the long-term part, because it's and if you do know someone who has a better answer, absolutely, I'd love to hear from the crystal ball here. But
Yeah.
but our focus right now at Gilead is, let's get a therapy out there. Let's find a way to let's focus our attention on this being a very, very interesting science problem, and let's find a way to get science to get us to a new frontier.
Well, and I'll say, Joydeep, you're being modest. I hope most people in the audience know, but Gilead's treatment today is the best one we've got so far. So thank you for everything you're doing.
No, and Sam, I think I love your point right now, right? It's until I saw the contrast between 9/11 and the Great Depression, I genuinely didn't foresee. And we are so consumed in our labs. Our life starts and ends in the labs, right?
Yeah.
And when you step back and think about retail and think about way people get on transport, there's a world out there right now, right? And I think we've just got to be ahead of the curve right now. What I will say, and is not just Gilead. There's pharmaceutical sciences, especially in the United States, we are lucky, right? We are at the frontier. There's a lot of innovation going on. There are a lot of bright people. There are a lot of new scientists that will be inspired to work in the space, and I'll bet on them, Henry, right, to get us out of this mess.
Yes, so I want to touch on a question that came in to the audience, and also one that I had was, what are you? It came up earlier. I think Joydeep, you mentioned, ensuring that you're supporting employees' mental health and emotional well-being as well. I'd be very curious to hear from you all kind of what your existing strategies are. Do you have like a plan over the next 6 months that changes the way you've previously interacted with employees around mental health and emotional well-being? Karen, I would love to hear what that looks like in the retail world, or how that's changed.
Well, I think that specifically for URW, and I know for a lot of people on my team, they are working mothers, and they're homeschooling, and finding that balance is continuously a challenge, and we are doing everything we possibly can to continue to support the collection of those people that are continuing to homeschool. And it's been different by state and county in regards to when schools are actually going to open. That, we've heard on the East Coast of some schools that aren't going to open until 2021. So what does that really look like for those employees so that we can continue to support them? both professionally and personally. So we've really started to look at programs around that. What we've seen in retail, I think, is dramatically different. I think that with the CARE Act and some of the stimulus programs, the lower wage workers that are the salespeople at a lot of these establishments are making more money through their funding from the government and their unemployment checks, and they've opted not to come back to work at this point. And so retailers and restaurants are really struggling on reopening, and that's going to continue to really hurt those smaller businesses. And I think that that's really unfortunate at this particular time, not only from an economy perspective, but many of them are struggling to actually recruit and find people that can come in and provide those services to the customers that are shopping. So, you know, that's what I've been hearing from the tenants and especially from the restaurateurs around some of their current challenges in the dynamic of what's been provided today.
Sam, from your perspective at Oliver Wyman internally and also more broadly, what do you see as kind of the important things to support your employees' mental health and emotional well-being as well?
So the mental health question is a great one, and it depends a little bit on the day. You either see a sort of bright side to COVID related to this or a new crisis. We have had a dearth of appropriate mental and emotional health support in this country for a long time. And more than 50% of the counties in the country do not have a single licensed mental health clinician. Right? We just have huge deserts where people can't get this kind of support. We're lucky here in the Bay Area. People who graduate with degrees in psychiatry and psychology tend to gravitate toward nice coastal cities. And in fact, we have a lot more access here than most people in the country do as a result. On one hand, COVID has dramatically increased the demand for these kinds of services and really are starting to overwhelm the system. And if you talk to anybody who's in the coaching or counseling business, they're seeing huge demand that they never had before. The other side of that, though, is COVID has brought people into ways of receiving this kind of support virtually that they never previously tried. One of the stats that sticks with me is our colleagues at Mercer have looked, and for some time now, 70+% of all people with insurance have had access to some sort of telehealth service through their employer, through their provider, through their health plan, whoever it might be. Well fewer than 10% had ever used it. That changed dramatically in the last 3 months. We're talking 100x utilization increases in things like telemedicine. And what brings me some hope is that for mental health, it's actually more effective. What we know is it's about 30% more effective because it takes away the stigma. It has people engage in a place that they're comfortable. They're not necessarily seeing somebody in the face. They may be engaging by text. And people do get better working through things like coaching, counseling, cognitive behavioral therapy works better virtually. So the hopeful part of me says that we are proving that we can provide access to the kind of mental health support that people need and that actually works better in a much more cost-effective, democratic way than we ever have before. And in the meantime, I think employers need to be really investing in those resources and encouraging people to use them. They're a very small cost for a very large return.
That's fascinating. I didn't know that, you know, mental health services were becoming more effective over Zoom and teleconferencing, but that makes a lot of sense. Joydeep, I know you had mentioned originally the importance of, you know, supporting your employees through you know, emotional challenges or mental health, especially during the crisis. Could you elaborate a little bit more on what Gilead is doing on that front?
So I won't reframe Sam's statement because that's exactly what we're doing, right? We're making it more accessible. We're partnering with companies that have more telemedicine, right? Like Livongo and Lyra and a lot of stuff right now. And it's democratized as well as made things more accessible, right? There's less inertia logging onto a Zoom call and getting help as opposed to going to, you know, a space. What I will say is maybe an ancillary point to what Gilead's doing. What this has done is it's also brought out the best in us in terms of recognizing that everyone's situation is different, right? We've got working mothers. I'll tell you my situation. I'm super constrained. Pre-COVID-19, I have a 6-year-old and a 3-year-old in a very modest townhome in San Francisco. And it's brutal for me getting on Zoom calls, right? I mean, there is a 50% chance my son will come into the Zoom call, right? And that's just the nature of this right now, right? And I think I have threatened you with this before, Henry, right? Where this is the nature of my work right now, where things happen, and they have their Zoom calls, etc. So what Gilead's done is recognize the fact that it's okay to have HR put an invite on the calendar at 5 p.m. that says reading stories for kids, right? Or a coffee with all the working mothers and that kind of stuff, right? So I think they're recognizing there's a different aspect to mental health and well-being, and just being. Work's not just about work anymore. We're letting people into our living rooms. We're letting people into our homes right now. And I think there's an element of just personalizing offerings from an HR perspective that's really resonated with at least our employee base. We're super lucky to have an HR team that is like, I have every Friday I have a story reading or a preschool story reading that's orchestrated by our HR team, and it's well attended, and it's one of those things that just gives us a little bit of comfort. And then I'll end on the final note. I think the one aspect of just emotional well-being is to equip managers in your company with conversational tools to understand that this is not business as usual, right? You know, we're going through reviews, we're going through, goal setting and all that stuff. And eventually your experience at work is a function of how your manager sort of kind of treats you. And the entire manager rewiring around being more flexible, being more agile, being more empathetic, being more inclusive is a huge component of what Gilead's focused on, to ensure that the experience every employee in our company feels is one that is grounded in our core values.
Thank you all for providing those updates. I think another thing that's come from the audience is the curiosity around what you all are doing to work with public health officials as reopening becomes a reality. Karen, I know you've done a lot of work in Los Angeles around this. Could you tell us a little bit more about what the relationship has been like with public health officials and what you're doing to coordinate with them?
Sure. I sat on the retail reopening for Mayor Garcetti's office, and they had 11 industries that they focused in on, whether it was manufacturing, film industry, high touch experiences, stadium, concerts, things like that. So the mayor's office and his team brought Boston Consulting in, and we worked through what we felt were guidelines for safe operations within 11 different industries. And we have continued to have that open dialogue with them, with the county. We worked directly with the CDC guidelines and really tried to understand also what that phasing looks like in reopening these different businesses, but also places of work. So I think that the county has played a critical role in that. And we've, in addition, I oversee some of the construction aspects. So we've really worked closely with the governor's office in regards and reached out to land use attorneys in regards to what construction really looks like in the new world and jobs that take two people to do that. We can't comply within the 6-foot social distancing. So really working with what OSHA has provided and reaching out to experts within the field has been a really critical part in how we've tried to maneuver through these uncertain timeframes where there haven't been very strict guidelines that have been presented through different agencies. And that's a little bit about what and how we've been working with our government partners.
That's very helpful and interesting context around, there's uncertainty within uncertainty as we're looking forward on this. Sam, Joydeep, do you have anything to add on what your relationships with public health officials have been as we're looking at reopening?
Yeah, so I mean, we've engaged public health in two regards, right? We have a external coronavirus response team that's focused with FDA and all the other stuff around remdesivir, which is different. But we've also had we have a lot of construction going on. We have a lot of reopening going on, and we've had a phenomenal partnership with everybody in Foster City. That's our corporate headquarters, but all the local, we have 35 offices globally. And I think it's also brought out a degree of can-do attitude and innovation, right? I mean, we have 27 construction projects going on right now, and most planning commissions and not just planning commissions, the health officials, they've been very supportive of returning back to work as long as they are assured that we have rigorously looked at safety. So it's brought out some good behaviors, some great collaboration, some great partnership, and I can't speak enough for the ecosystem we have in California in terms of moving things forward in a safe fashion. And I'll keep it at that.
Yeah, I completely agree. And we have our own relationships as Oliver Wyman, but when I think about the companies we work with more broadly, I would hazard a guess that at the beginning of this year, most leaders couldn't have named who their local public health officer was. And now you probably have his or her cell phone number, or at least know somebody in their office. And this is the point I would emphasize, that we will survive COVID, we will get through it. But this will not be the last public health crisis that we see. The nature of globalization, the nature of climate change just means we're going to see more and more of these issues, and that no matter how big a multinational company you are, you need not just those federal relationships, which might be lobbying for whatever issues are important to your organization, but you need those state and local relationships. And actually, I think it reinforces the importance of organizations like the Bay Area Council, that if you are a big national or multinational organization and you don't have somebody who's responsible for having relationships in every location where you have a facility, you got to get one, and you've got to do that, because this kind of partnership is going to be the difference between being able to get through the next one in a much less bumpy way and not.
Yeah. Next question, we got one for Joydeep, specifically around manufacturing and productivity. Do you feel like the physical distancing that's required and social distancing as a result of COVID-19 will affect productivity for Gilead, or are there different things you're doing to ensure you're able to keep up the same pace?
Short term, yes. I mean, in the short term, we're going to have to socially distance, which means the only way to get that done is by having less densification. Long term, no. I firmly believe we'll find solutions. This will accelerate automation. It'll accelerate mobile. It'll accelerate ways of. The beauty of this right now is, in linear programming, you can't optimize a problem you don't constrain, right? It's put a constraint problem right now that I think we'll find an optima. And what we'll do is, okay, if we can't do it this way, now you're going to have regulations and policies that will change to allow for more innovation to be built into the process. Right now, you might be okay releasing a batch of product remotely. You might be okay signing a batch record on the mobile phone as opposed to being there physically and signing it. And all this stuff, which was, like I said, heresy 5 years ago, is not going to be par for the course, and it might accelerate innovation. So our approach has been, yeah, in the short term, absolutely, because employee safety, we don't know enough of this, right? So we don't want to be too cute here. We want to make sure that people are safe, people are secure, people feel good about it. But in the long term, I think our approach has been, this is an opportunity. This is an opportunity to accelerate every innovation that previously was classified as efficiency, right? And now make it part of risk management and day-to-day business. And I think that's where the mindset shift has changed right now. So I don't see I don't even see the long term. I don't see the midterm, this impacting manufacturing and R&D productivity, because we will find a solution around this.
Sam, on that, thank you, Joydeep, on that piece about opportunity. Do you see, with a kind of a broader lens, how this is all going to affect productivity on a broader scale? Maybe it's not just manufacturing, but just looking at other industries as well.
Yeah, I think there is a lot of opportunity here, and we've already been working with organizations who saw real barriers to advancing things they already needed to do come down because of the crisis. And utilities are quite good at this. They're used to dealing with storms, and most utilities, after a storm happens, will sit down and say, okay, in that crisis, what barriers did we eliminate that we want to eliminate permanently so that we can continue to move as quickly? And I'd encourage everybody, and this is about the point to do it, to look around and say, what did we previously take for granted as slowing us down that in the last 3 months we somehow overcame, even though we couldn't overcome it for years? And that might be meetings or approvals or, you know, people who didn't talk to each other or lack of trust or whatever it was. And how do we retain that and move faster? Because most organizations know what they need to be doing and know what they need to be working on, or they can get there pretty quickly. And the ones that really succeed are the ones that can get those obstacles out of the way and actually make progress. The other thing that has me optimistic is the remote working environment for all of the horrible unemployment statistics that we see. And California is actually worse than most now, unfortunately. Virtual working creates opportunities for people we wouldn't consider unemployed, but who are underutilized, to remain in the workforce. And the stories that I have heard, I was talking to a physician who sold her practice and was going to retire, but instead now she practices 3 or 4 hours a day via telemedicine. I have talked to women who have said, well, if we're not traveling and it can be virtual, I might be willing to do a glide path out of my maternity leave, as opposed to kind of a hard barrier that says, here's when I come back. We've heard people with children who say, if I can work 8 to 2 from home, then I'll be part of the workforce again. And I will do that. And there are immensely talented people out there who have been structurally excluded, and we haven't been taking advantage of their productivity simply because we require them to get up and get dressed and get in the car, get on an airplane, and work in a very specific format. And I think we've learned about how we don't always have to do that through this crisis. And I think there's going to be some really smart organizations who are going to view themselves as having access to a workforce that is much bigger and much more diverse if they capture these lessons.
Yeah, the common word I'm hearing here from Joydeep and Sam and you as well, Karen, is opportunity. So I'd love to get your perspective, Karen. I know retail is a bit of a different landscape, but what sort of opportunities do you see with the changes that have been kind of forced upon us with COVID-19?
I think that they're endless. Just to piggyback off of Sam's earlier comment, I think that retailers in general are looking to say, how do you completely reinvent the experience? You know, what does the physical store even look like? Do they need as many physical stores? You know, the retailers that weren't embracing the omni-channel have really decided to say, you know, this is our opportunity to do just that. And I think that with that comes a real high level of personalization that I do think that the end users are really looking for when it comes to an experience that's specifically geared towards what they're looking for, whether you're buying, you know, a t-shirt, a handbag, or you're actually going to a boxing class or theory or something like that. I do think that it's such an interesting dynamic. We've had all this time kind of away from each other, yet we've actually probably been the closest that we've ever been to some of our coworkers and our family members through this level of technology and things like Zoom. And I think that we're going to see more and more our tenants and the experiences that are provided to the different shoppers really embrace that next level of technology so that they can have a far further reach than they've ever seen before. I mean, I've seen some great experiences from digital showcases of new lines that retailers are doing. So you no longer have to go to the fashion house in Paris. They're actually bringing, you know, Louis Vuitton's bringing the individual that's hand stitching the bag to a video so that you can see that within the luxury of your own home. And there are going to be a lot more opportunities where you don't necessarily need to leave your house. And I do think that a lot more people are going to start investing in their home and making it somewhere that they love to be based upon this this safer at home experience. So I do think that, again, you're going to have some retailers that have a huge opportunity to take advantage of really where the consumers' behaviors are going to go towards and what the shopping trends will really look like as we head into the back half of the year.
Thank you. I was curious as well, does that change? Obviously, we have lots of shopping malls already, but does that change the design of them, the existing ones, or as we look forward towards shopping, does that change what malls look like altogether, or the shopping experience?
I think we're constantly re-looking at the, what we're providing to that local community. We do see our assets and our physical malls in every community to be specific to that community, and really try to embrace what that community is. When you go to San Francisco Center, it's a completely different experience than if you were to go to Roseville or Valley Fair or Oak Ridge. So we do really look heavily at the demographics of who that shopper is, and we try to provide the services and the offerings based upon that demographic. And I absolutely think that will continue to evolve the experience as, what it is today. I mean, we really do see and have a lot of great future plans for some of our centers in regards to housing and developing apartments. We've definitely taken a step back and said, what does commercial real estate really look like, with people saying that their employees can work from home more frequently? Are there opportunities to provide more, thinking really differently around, are there opportunities to provide a space in which all these work from home people could come and have a professional video conference situation? And there are remote places in which you could do that. Are there places where people can come together and have meetings that feel like you're sitting all together, but you're in 12 different places, and it not be on Zoom, but it be through a facilitated, whether it's interactive whiteboarding, those types of experiences. So I think that we're constantly looking to see where that behavior is going to go, and then how do we adapt our offerings to the local communities to that.
Yeah, sounds like there's lots of opportunity across the board. I think something that came up, it's a big question, and I'm going to reframe it a little bit, but what should companies do in this uncertain environment? What should Bay Area companies do in this uncertainty? I'd love to hear from you all, kind of from your perspective, from your experience, what has worked, what maybe you feel like is the opportunity for companies. How should they approach the uncertainty that we're in now as they look towards the next year or so? And maybe we can start with you, Sam.
Yeah, so there's a lot that we just have to do. I mean, the first thing I would say is like most places are doing, make sure you're thinking about employee health and safety. Continue to work with your local public health officers. Think about what you're doing to bring people back to work. I would say, the sort of philosophical approach to that, and one we've adopted at Oliver Wyman, and Marsh McLennan Company is our parent, is make sure you are accommodating each employee's unique situation. The idea that I'm going to reopen and bring people back to work, whether they can come back, has a lot to do with their mental and emotional well-being, their family's situation, what their health conditions might be, so-called hidden disabilities that we don't always think about, and being willing to be flexible as they come back, and not saying we're going to have a one-size-fits-all solution matters. But then I would, broader than that, I would say don't waste the opportunity. It's sit down and do like the utilities do and say, what obstacles got out of the way and how are we going to keep them out of the way? And to Karen's point, in many industries, really anything with a physical location, Amazon has been the great agitator for some time now. And I think retailers and others have been saying, if somebody else can put it in a cardboard box and deliver it cheaper, then I don't have a competitive advantage. And that's not what physical experiences should be about. They're about connection and service and experience and a certain degree of intimacy. And I know a lot of organizations that have been working on that for some time. This accelerates that move. To say now's the chance to prove how you can serve humans who are naturally social creatures in a way that is safe and accommodating for them. then do think about opportunities to use digital to be more affordable and more accessible. Back to the industry I spend most of my time in, healthcare. When we look at things like virtual visits, they're more convenient for people because you can take them at the time they want. They're more accessible because you don't necessarily have to be in a particular neighborhood, but they're also a lot cheaper. They're a lot cheaper to deliver, and the prices can be lower. And that shouldn't be a temporary solution until we can get people back to the old way. That should be a permanent shift, and people need to take advantage of that.
Thank you. Those are great insights. Joydeep, from your perspective, Gilead's obviously adapted and shifted as a result of COVID-19, both from how manufacturing works, ensuring your employees are supported both emotionally and in their mental health. What do you see as important for businesses to keep in mind with this uncertainty, and specifically to support their employees through this?
I mean, I'll probably just again rephrase what Sam said, right? Look at this as an opportunity. Look at this as a place where you are now unconstrained. I mean, there's another backdrop, Henry, right? It's not just COVID-19 that we're dealing with, right? There's a ton of, just fundamental racial injustice right now that's coming to bear. That's also impacting the fundamental way we work. And, I don't know if it was Sam or Karen who made the point, right? This new normal might allow us, to change the dynamic of what it's like to actually succeed at work and have equal opportunity and have greater access to diverse sort of workforce. And I think the uncertainty can be either a thing that makes your mind spin, or it can be an opportunity, right? And I think from Gilead's perspective, our view is we're lucky, we're privileged, we're humble about the position we occupy in the biotech industry. And what we want to do right now is sort of just take this new normal and redefine a new standard in diversity, in inclusion, and I think it was Sam, you mentioned the point, right? I mean, the way we are inclusive right now is far better than we ever were.
Yeah.
Right? I mean, people have access to thriving at work because you're unconstrained by whether you have a child at home or whether you have this. Because it's made this a level playing field. And I think if you can expand that and make this a opportunity for us to be a new generation of leaders that actually drive a different diversity footprint, there's an opportunity here, right? So I think it's a long-winded way of saying that, the way to get over this uncertainty is to mine for the opportunities, find a way to get good out of this, and recognize that we have a huge support system in the Bay Area that can sort of collaborate. One thing that wasn't talked about today was the fact that this pandemic has also broken down all these artificial barriers around collaboration.
Yeah.
I mean, Gilead's working with other pharma companies, unheard of, right? That we'd work with other pharma companies to get drugs out there, right? Because when you're constrained, right, you have to figure out a way to solve the problem. And I think there's a humanity that's coming out there. And I hope that post this pandemic, post everything we're going through with the backdrop of political unrest, that we emerge stronger and we never forget this period, because I agree with both the speakers that this will happen again in 5 years, right? And we don't need to reinvent the playbook then. We need to lean on the playbook we're developing right now.
Well, I know we're getting close to the close of the hour, so I want to give an opportunity for any of you to make final closing remarks, and also to thank you all for your leadership and providing such great insight today. I've gotten a lot from the discussion. I hope the audience has as well. But if any of you have any closing remarks you would like to share, this would be a great time.
Henry, I might just build on what Joydeep just said. There's this kind of paradox of, I think, inequality issues that we have as a result here. That on one hand, I am an optimist, and I'm optimist about the power of technology and virtual working and getting out of our own way in terms of these habits to bring more people in to the conversation. But there are also things that this crisis is doing to reinforce the inequality that we have, particularly in this country. We in the first 6 weeks of the economic crisis that resulted from COVID eliminated all of the job gains that African Americans made since the 2008 financial crisis, right? We got rid of all of that. The power of virtual working is that it can bring more people in, The downside of it is that it re-emphasizes the digital divide that we have, and that having broadband at home is really like having electricity or water if that's the only way that you can work. And so I am optimistic that there are solutions to that, but I think all of us as leaders here in the Bay Area need to be mindful of those. That when we think about how we bring people in, well, what are we doing to provide broadband and connectivity for people? As we think about hiring, how are we doing our part to reduce some of those disparities in the unemployment rate, and think about who we're bringing into our workforces? As we're thinking about working with our customers, are we being gracious and forgiving of those who may be in a tough economic situation and need a couple of months to catch up? So there's opportunity. I think we just got to do this with our eyes wide open and not create new kinds of inequality as a result of the new environment.
That's a great point. I think it's something that we're all re-examining as well, and ensuring that we're coming out of this in an inclusive way and developing new systems to strengthen opportunity as well. Well, I want to thank you. Karen, did you have any closing remarks?
No, I piggyback off of what Sam has to say, and I do, I truly believe that there's an opportunity for every individual to, pull down their individual leadership and deepen that within their organizations, and to really think differently and, reach to be able to come out of this with something that has us progressing so much more forward than we've ever seen. And I have huge hopes that the generations to come are going to really be in the forefront of a lot of those decisions and leadership abilities to do that. So I think it's a good time for everyone, especially in the Bay Area, for everyone to really come together and break those silos and find those opportunities for access and personalization for each individual. So I'm excited to kind of step out from this.
Great. Well, thank you all for joining us and providing your expertise today. We really appreciate it. Thank you to the audience for joining us today. Again, we'll be sending out a recording of the webinar following probably in about a day. And we really appreciate you taking the time. And if you have any questions, please feel free to reach out to me or any of the Bay Area Council staff to follow up as well. Thank you, Sam, Joydeep, Karen. Really appreciate it.
Thank you, Henry.
Henry.